drugs on breastfeeding. How drugs affect the breastfeeding and when drugs are absorbed into the breast milk and when they are not excreted. So we have two categories of drug based on their effect on breastfeeding. Galactogog, that increase milk supply, dopamine antagonist drug which block dopamine receptor, or galactogog in nature, that is enhanced milk production, is seen with them. Now, metoclopramide is a dopamine antagonist and hence galactogog in nature. Now, drugs that decrease milk supply includes dopaminergic agents that produce dopamine-like effects that decrease milk supply. Example of dopaminergic agents are bromocriptine and amantadine. Other class of drugs such as estrogen and diuretics also affect milk production adversely, that is, they decrease milk production. Now, factors that affect drug transfer into breast milk includes lipid solubility of drug. The more a drug is lipid soluble, the more it is secreted in breast milk. Now, fat-soluble drugs such as benzodiazepines, opioids, and many other CNS-active drugs that can pass blood-brain barrier are actually lipid-soluble, and they also dissolve in lipid globules of breast milk. As a general rule, their increased lipid solubility of a drug increase their penetration into breast milk, and hence their effect on baby is seen. Now, milk pH level also affects, because breast milk has a lower pH than that of a blood pH. So, because that are weak bases, drugs that are weak bases, for example, propranolol, become ionized in milk because milk contains fatty acid and hence it is weakly acidic. So, it dissolves more better the basic drugs, weakly basic drugs. They diffuse back into plasma because we know that basic drug ionize into acidic medium and hence they are more soluble in ionized form. Nearly to say that milk is actually a weakly acidic medium which is suitable for weakly basic drugs. Now, endpoint is that milk being weakly acidic dissolve weakly basic drugs betterly, hence drug having slightly basic nature show a tendency to appear in breast milk, and hence it can affect the infant if there is significant quantity in breast milk. Now, molecular size and molecular weight of the drug also affects breastfeeding. Bulky molecules, that molecule having large molecular weight, appear in breast milk. Now, drug protein binding is another factor that affects breastfeeding process because highly protein bound drugs such as warfarin and phenytoin do not normally pass into breast milk in significant quantities because only free unbound drug passes across the capillary wall and can diffuse into the breast milk. Hence, protein binding of drug is inversely proportional to diffusion into breast milk. The more a drug is protein bound, less likely it is to diffuse into the breast milk and vice versa. Now, fifth factor is maternal drug plasma level. As drug enters the breast milk by diffusion, the higher is the concentration of a drug in plasma, higher is its diffusion rate into breast milk because diffusion is a concentration dependent process. So it is dose dependent. Drugs that have shorter half-life appears in breast milk for quite short time because after that they are eliminated from the blood and thence they can't appear in breast milk afterwards. During first 4 days after delivery, drug diffuses more readily into the breast milk because there are gaps between the alveolar cell walls into mammary capillaries. These gaps allow drugs and immunoglobulin molecules and maternal proteins to appear in the breast milk. That's why there is increased concentration of drug into milk in neonatal stage. These gaps close after 3 to 4 days, resulting in decreased drug concentration into breast milk. Now, drugs such as iodide, especially radioactive iodide, pass into breast milk through an active process. That's why they are concentrated into breast milk. Hence, it becomes necessary to interrupt or stop breastfeeding. Bibliography. The above information was taken from Oxford Handbook of Clinical Pharmacy. Thank you for watching. Please don't forget to like and subscribe. Keep studying from Pharma Tutor. Your comments, suggestion and feedback are